Advisor to the Government of India, Dr. V.K. Paul, Member Niti Aayog, Mr. Vaidesh, President OPPI, and Ms. Kanchana TK, DG OPPI, ladies and gentlemen. Well, thank you very much, OPPI, for inviting me again. It's nice to come back since I joined you last year as well for your annual summit, and we discussed a lot about the non-communicable diseases, the challenge that it has posed to the global community, and how we could prepare ourselves for dealing with it. And this year, as we all know, the theme is quite apt: health meets hope. I was very impressed because especially in a situation where the government is all set to roll out the universal health coverage, Ayushman Bharat, a giant step to translate the hope of universal, affordable, quality health into a reality. The role of pharmaceutical industry is definitely critical, not just in providing the right medicine, but more so in innovating and collaborating with the government in designing a creative solution for a large population like India. The Government of India has a broad vision and committed to provide affordable and quality healthcare to all the citizens. And our Honorable Prime Minister, Shri Narendra Modi ji, has always encouraged doing things in an innovative way, and finding newer ways to deliver healthcare has never been more important than it is today. The NDA government has once again taken the innovative initiative in the form of Ayushman Bharat, which you saw in great detail during the presentation made by Dr. Paul. The Ayushman Bharat, one of the pillars is National Health Protection Mission, which is a very important step towards making the benefit of health services available to nearly 10.74 crore beneficiary families, especially the children and the female members of the household, the senior citizens whose health requires more attention than others. And in the mission, the benefit of rupees 5 lakh will be provided annually so that even the most expensive treatments are easily within the reach of the beneficiary family. And there is no restriction on the number of members in the family, which means there is an assurance of everyone getting included. The scheme is on an entitlement basis, which means that the names of the family members which appear in the SECC Socioeconomic Caste Census database are eligible for benefit automatically. This is a paperless scheme, a cashless scheme, which is free from the hassles of documentation, and no charges are required to be borne by the beneficiary. He or she can avail the treatment all over India, in any participating hospital, any government hospital, or any empaneled private hospital across the country, and not just in their own home state, which Dr. Paul also said that suppose you belong to UP, but you fall sick in West Bengal. So it's not that you cannot take treatment in Uttar Pradesh. This is the best part, I would say the most important feature of this Ayushman Bharat, the National Health Protection Mission. We should focus on spreading the awareness and delivering the clear message and information to the beneficiaries. Both the state and center have a role to play in this activity. We also need to ensure that every provision to help the beneficiary family in availing the benefits is implemented in the most beneficiary-friendly manner. And that is why both state and center need to work together very closely, just like they have done till date in planning and designing of this mission. And the same coordination and commitment must continue in the future as well. And we see that 25 states and UTs as of now have already signed an MOU with the National Health Agency Government of India. With 1.3 million population base, which constitutes 18% of the global population and contributes to 20% of the global disease burden, India holds an important position in the global pharmaceutical sector too. This sector is highly innovative and on an strong upward trajectory, and with an immense growth potential, would have to play a significant role as an innovative manufacturing hub to make available essential drugs and medicines as the cost-effective prices for universal health coverage. India's drugs watchdog and regulatory body, the CDSCO, is creating a comprehensive national digital database of pharmaceutical manufacturers and the medicines that they produce. Also, with the release of the draft Pharmaceutical Policy 2017 by the Department of Pharmaceutical, quality assurance of drugs is the top priority of this government. A large population of poor people in the country finds it difficult to afford the expensive branded medicines. Ensuring availability of quality medicines at affordable prices to all has been the key objective of the government led by Honorable Prime Minister Shri Narendra Modi ji. The Jan Aushadhi initiative launched by the government is making available generic medicines which are equivalent in quality and efficacy when it comes to therapeutic value, just like the expensive branded drugs at affordable prices through dedicated stores. Under the Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana, more than 3,100 Jan Aushadhi Kendras have been made functional across the country. The National Health Policy 2017 envisages as its goal the attainment of highest possible levels of health and well-being for all at all ages, with a promotive healthcare orientation in all the developmental policies and universal access to good quality healthcare services without anyone having to face financial hardships as a consequence. And this would be achieved through increasing access, improving quality, and lowering the cost of treatment and healthcare delivery. In line with this goal, the government has announced Ayushman Bharat in the Union Budget 2018-19 with its two strategic components, which I said before. One is the National Health Protection Mission, and the other being the comprehensive primary health care being provided by means of a network of the health and wellness centers. 1.5 lakh primary health centers and sub-centers are going to be transformed into wellness centers, and the process has started with the Health and Wellness Center, the first one being inaugurated by Honorable Prime Minister in Jangla village of Chhattisgarh state. Ladies and gentlemen, the Health and Wellness Centers will also serve as a two-way referral mechanism, upward for secondary and tertiary care and downwards back to family and community, and financial protection for secondary and tertiary care hospitalization will be done through the National Health Protection Mission. Statistics reveal that 72% of the OOPE, the out-of-pocket expenses, is on the primary care. And the lack of effective primary care leads to fragmentation of services and also the burdening of the secondary and tertiary level institutions. The comprehensive primary care reduces mortality and morbidity at much lower cost and significantly reduces the need for secondary and tertiary care. Ministry of Health and Family Welfare has the ICMR and related autonomous research bodies for innovation in treatment and allied spheres in terms of innovations of program delivery and infrastructure, etc. Under the National Health Mission. Innovations across the country are simulated, and the best and exemplary states practicing the innovations are awarded at the annual event. About